Good evening. I'm John Batchelor. This is the John Batchelor Show, the day after the State of the Union 2014. I'm joined by Mary Kissel of the Wall Street Journal's editorial board, the host of Opinion Journal, each day at 1 p.m. at WSJ.com. Mary's job and the job of the editorial board to look at the president's State of the Union message as delivered, as opposed to the preparation or the spin or the documents beforehand, because there were big words about a pen and a phone, about executive action, about if I'm not going to wait, year of action. It was a little disappointing to me that the president was muted and did not use that metaphor. Mary, a very good evening.
Hi, good evening, John.
I did not hear pen and phone. Did you hear pen and phone in the speech?
I heard I failed because essentially the president said, we've been in recovery, but gosh, the recovery really stinks and we ought to do something about that. 5 years into it, John.
Unemployment insurance. However, we're going to come to the part of the conversation with the United States, because this wasn't just an address to Congress. This was an address to the American people, in which the president emphasized the Affordable Care Act. He used metrics, and they swam by you. If you follow this very quickly, millions were mentioned several times, and one particular state, Kentucky, was picked out. Of all the states, oddly Kentucky. And there are reasons, there are speculations for what the president didn't say and why Kentucky. And we welcome now Francis Rose of In Depth with Francis Rose each afternoon on Federal News Radio. Francis, a very good evening to you. I want to begin with one puzzle and see if we can confront it directly. The president gave us big numbers, millions. However, he used this term signed up. What did that mean, Francis? Signed up. Is that the same as enrolled? Is that the same as paid? Good evening to you, Francis.
Good evening, John and Mary. No, it doesn't mean the same as any of those things that you just said. Signed up, in the terminology of how the federal government usually approaches things like this, means that you successfully completed the process of giving them your information and they confirmed that you qualified for whatever you qualified for. So in the case of healthcare.gov, you went through all of the hoops that you had to. They have your information. They've confirmed whether or not you qualify for a subsidy or if you're going into the Medicaid program and all of that. But with this, if you don't qualify for Medicaid, then you still have to turn around and mail a check in to whoever it is that you buy your policy from. And that's right now what nobody in Washington really seems to have a handle on, John, is who's enrolled and actually completed the entire process, including paying the premium.
Francis, do they not have a handle on it, or do they simply just not want to tell us because it's an embarrassingly low number?
Well, the answer to that is nobody knows, because they're not even saying why they're not saying, Mary. A lot of people believe that it's because they don't know, because the insurance companies have had such a hard time in some of the state exchanges and with healthcare.gov in getting the correct information. You recall the stories back in October where people were even getting, when they tried to sign up, they were seeing other people's information. So that seems to be a back-end problem that the government's not able to get a handle on, because they're not sure that the health insurance companies can tell them everybody who's signed up, who's gotten the correct policy, who's gotten the correct supplemental coverage, the subsidy coverage, and then on top of that, who's actually mailed in their premium.
Francis, you see numbers and you hear spin in Washington. Mary, the same at the Wall Street Journal editorial board. I know I see these numbers swimming by me all the time. There's one number I've seen over the last 20 days, at least since the excitement of signing up by January 1st, get your check in, which is that it's an estimate and it's the best we have, and perhaps the insurance companies did it. I don't think HHS or CMS did it. It was that only 11% of the people enrolled, signed up, paid, I don't know, only 11% of whatever number they want to talk about are the previously uninsured. Francis, have you seen that number, and have you seen anything else besides that number estimating about those millions of people, tens of millions of people we were told were uninsured? And that's why we built this great big Tower of Babel. Have you seen another number besides 11%?
Yes to the first question and no to the second question, John. I have seen the 11% number, and I haven't seen anything to contradict the 11% number. And I'll leave it to others to determine whether that's a good return on investment, what we've got so far. But no, I'm not aware of any other number.
Mary, have you seen it?
Isn't that the Humana study? Just throwing that out there for the listeners, they might know.
I'm willing to go along with any study. The problem is that if it's 11% of the uninsured, where are the uninsured? We built this for people who couldn't get insurance.
Are you sure, or did we build this on the road to a single payer?
Well, John, I would also argue that a lot of the discussion was that this was built for people who didn't have insurance. And
uninsured, right? That's what uninsured.
But that doesn't necessarily mean they couldn't get it or didn't want it.
Right.
Wait. Let's unpack this again. All right. Is it because they're poor? Is it because they're between jobs? Is it because
maybe they're healthy? They feel like they don't need it.
Although, let's enter the twilight zone without the music. What if they didn't exist? What if that estimate was based on no good numbers? Have you seen anything to validate that 40 million? What weren't they all? They were always throwing around something in the 40 millions, right, of the uninsured, and they've been throwing that number. The Washington speakers have been using a big number since at least the first Clinton administration, when Mrs. Clinton first the Hillary Care back in 1993, a very big number of the uninsured. And it would make more sense to me that the reason we're only getting this 11% estimate is because there isn't that big number. It's in fact probably a pretty good percentage of the uninsured. We just don't know how many that is.
Or that number is accurate, John, and what they underestimated was the demand for insurance as part of that 40-something million number.
And I have to admit, I go more with Mary's analysis, John, than yours, really, because it strikes me that there was no research that I can recall and no great discussion in Washington that I can recall about the percentage of the 40 million that just simply weren't interested in entering the health insurance market. They were satisfied, young people, bulletproof, whatever you want to call them, that were satisfied carrying no health insurance and paying as they went. That seems to be a pretty substantial portion of that market. And I think what bears that out is the amount of marketing that the administration's tried to do with organizations that appeal to 18 to 24-year-old people, men and women. They wanted to partner with the National Football League to get young guys to sign up. That says to me that Mary's scenario is probably likely. These folks exist. They just decided a long time ago they didn't really care about health insurance.
Kentucky. The president emphasized Kentucky in his speech, and he pointed to the governor of Kentucky, and he praised him. He even called him Steve, I think. It was very friendly. Now, there is the possibility this is because Mitch McConnell, who wants to be the majority leader of the Senate, should things go well, but certainly is the minority leader, is running for re-election in Kentucky, and the polls at least indicate that it's a contest. Maybe a primary contest it's not, but maybe a general election contest it is. However, why Kentucky? They have covered California, and covered California routinely, every 12 seconds, I get a bulletin from covered California, how great things are in California. Why did they go with Kentucky? Francis, do you have an explanation for this?
Well, I think your political calculus is accurate, for one thing. Mitch McConnell's been one of the most outspoken opponents of this throughout the entire process, from back in 2009 when this whole process began. He's been very outspoken against it. So poking him in the eye in the State of the Union address in a backhanded way like that would seem to make sense. The other issue is they have been very successful in Kentucky in signing people up for the Medicaid portion of this, the expanded Medicaid. And it strikes me that it's possible when you become a Medicaid client, you don't have to pay a premium. So if you go through the process on the website, sign up for care as a Medicaid person, they can count you immediately as enrolled, signed, sealed, delivered. You're in, and they don't have to worry about counting you later on when or if you decide to mail in your check.
Barry, do you like that? And do you think the president is merging these concepts of Medicaid, Medicaid Plus, and the enrolled to grow the numbers, and is willing to go to the American people and say this is a success because of the Medicaid signups?
It's extraordinary that anybody would boast about getting more people into Medicaid without looking at Medicaid itself and the quality of care that it delivers. delivers.
outcome,
It is
right.
the worst
Right.
of the worst. And so it's almost like public education, John. All you hear is we need to put more money into it, more money, without actually examining the failing outcomes here and trying to figure out how to fix them before you throw more money in. It's the same with Medicaid.
Francis, the mood in Washington, because you're reporting every day for Federal News Radio, as the mood in Washington soured on the Affordable Care Act, do they stop talking about it? Is it like a relative who's in jail and you just don't bring him up at Thanksgiving? Is that what it's like?
I wouldn't say that. I would say that the conversation has disappeared over the past couple of weeks, mainly because people are really entranced by the fact that Congress might actually pass budget bills this year and get back to regular order. And that seems to be most of the conversation that's going on in the Hill these days.
Federal News Radio's Francis Rose, In Depth with Francis Rose in the afternoon. Mary Kissel, the Wall Street Journal editorial board, and the host of Opinion Journal each afternoon at WSJ.com. I'm John Batchelor.